Okay, so here we are with Brenda, and we're gonna do our surgical markings, but also kind of just illustrate this concept of a diamond facelift, which we always include with a neck lift. So when we're doing our markings, we basically have 4 points. One here in front of the ear, and we're gonna make these marks in black. One along the jawline, one here at this nasolabial angle, and then one here at this zygoma. And so this is the area of the face that we're really correcting when we do a facelift, okay? And it's basically in a diamond. So we're gonna be lifting this diamond back up, okay? And in Brenda's case today, we are gonna address the lower eyelid skin. You can see that when we lift this up, or when she smiles, for example, she gets this extra lower eyelid skin. So we're gonna be doing a very pinch excision, lower eyelid blepharoplasty to address that. Now this diamond also goes down onto the neck. Basically, it's almost like a second diamond that we're gonna be addressing, like here and here. This whole area is gonna be lifted today. And so this band of tissue, people have various names for this, that's what we're gonna be lifting up when we do the neck lift with the facelift. And so for our incision today, basically, we're going to be improving this little bit of the brow that's also depressed. So we're going to be lifting this up. And so wherever we are lifting, we have to make our incision at least that high. And so I anticipate her incision going about this high along the tuft of hair here. And then we're going to be going around this to the ear, in front of the ear, behind the tragus, down around the ear. And then the back side of the incision will be along the back side of the ear there. And directly behind the top of the ear canal is where our highest point of our incision is going to be. So we're going to then draw that across. And then we're going to go along the hairline to address the neck. And so this area will be addressed by this incision, and the rest of the face as well. This will be recruited and lifted. And in general, we have about this much skin from here to here that's removed with a facelift. And so that's about 2 inches of skin, which will then be lifted up to correct and finish Brenda's facelift and neck lift. Any questions about that, Brenda? No? Okay, great. Well, let's get started. Our next step will be taking the oral sedating medications, which we use a combination of Percocet, which is oxycodone and Tylenol, Xanax, which is a sedating, fast-acting medication, Phenergan, which will provide some anti-nausea plus some antihistamine effect, and then we always give a oral antibiotic as well, in addition to an IV antibiotic that we'll give. And we'll have an IV in place if we need it for giving fluids or anything like that. But really, all that will take care of the anxiety, the nervousness, the pain that people might experience, followed by placing a lot of anesthesia in this whole area in the form of lidocaine, a dilute form of lidocaine, which will make Brenda very comfortable throughout the procedure, as you'll see.